Hi, I'm Dr. Matthew Stay from National Pike Chiropractic, and we are here continuing our review of the shoulder pain continuum. And if shoulder problems are ignored, they can progress from impingement, which is what we discussed last week, to another common condition, and that's rotator cuff tendinopathy. The rotator cuff is a group of four small muscles that hold your shoulder in its shallow socket. Strains and injuries to the rotator cuff are common, and as you have learned in the last couple videos, most of these problems are caused by repetitive strains over time rather than by an acute injury. The problem most commonly occurs when your rotator cuff tendon gets pinched each time you raise your arm, as in a shoulder impingement. The extent of damage can range from partial fraying to a complete rupture, and symptoms include pain in the front or outside of your shoulder provoked by overhead activity and sleeping. All right, so when we evaluate for rotator cuff tendinopathy, which again is the next step in the shoulder pain continuum, quite honestly, a lot of the evaluations are very much the same as what we would use for impingement, except there are a couple additional ones that we like to do to tease this out further. And the first one is called the external rotation lag test. So we would take Noah here, if he was having this problem in the right shoulder, we're going to take the arm out a little bit like this and rotate it all the way out. I'm going to hold it right here. Now, his job is to hold it here when I take my arms away, my hands away. And if he's able to do that, as he is here, that's a good indication that there's not anything going on in the rotator cuff. However, a positive test, if I take my hands away, would look like he's unable to hold that hand out there. Another test that we would do to tease this out is called the dime test. So what he's going to do, and you've seen something similar to this, where he's going to turn the thumb down, and he's going to have his arm in the scapular plane at about 45 degrees, and he's just going to lift it straight up against resistance. If that causes pain, we're likely dealing with something in the rotator cuff. And then likewise, we can bring it out all the way to the side. And again, he's going to raise it straight up overhead against resistance. And if that would cause pain, again, a big indication that we're likely dealing with some rotator cuff tendinopathy. Treatment for rotator cuff tendinopathy is typically very similar to that of impingement. However, as this is a progressive condition, the recovery tends to take a little longer than for an impingement problem because there tends to be more damage to the affected tissues. And sometimes rest is also important, especially if the patient is involved in an activity or a sport that is contributing to their problem.
But the approach is generally the same. We'll perform adjustments to the indicated areas of the cervical and thoracic spine, as well as the shoulder girdle. We will perform soft tissue mobilization to the affected tissues of the rotator cuff, as well as performing shockwave therapy and specific strengthening exercises to help support the rotator cuff. And additionally, we will advise the patients on lifestyle and activity modifications to help promote a full recovery.
Rotator cuff problems often have doom and gloom connotations, but it doesn't have to be that way. Conservative treatment options are a very effective way to treat rotator cuff tendinopathies without having to utilize the more invasive procedures such as injections or even a surgery. However, if the problem continues to be ignored, then it can lead to the last stage of our continuum, which is frozen shoulder. Now, we're going to review the symptoms, evaluations, and treatment options for that in our next video. And so, as always, I'm Dr. Matthew Stay from National Pike Chiropractic. Thanks for watching, and we'll see you next week.